Hi, I'm Bob Roth, Managing Partner and Co-founder of Cypress Home Care Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast, and enjoy the show.
Welcome back to Health Futures. Today, I have a special guest here in the studio with me. I got Dr. Jim Whitfill. He is a physician, and he's also a chief transformational officer. So we need to learn a little bit more about Jim. Can I call you Jim?
Please do.
All right, perfect. So let's kick things off. Welcome to Health Futures.
Well, thanks, Bob. It's really fun to be here. And anytime that I get a chance to talk about health and the future with somebody like as friendly as you, I know we're going to have a good time.
Well, I appreciate that. And for our listeners and our viewers, I'd like to learn a little bit more, me personally, I'd like to learn a little bit more about you.
Absolutely.
Where are you from? How'd you get into this?
Oh, this will be really fun then.
Perfect.
So I'm, despite the fact that I don't have much of an accent, I'm actually from Dallas, Texas. Grew up there. My whole family still in Texas. I'm the only one who left. Spent my first 18 years there. Then went to New Jersey and Pennsylvania for college, med school, all that sort of training. Met my wife out there. She was from Tucson. So after we got married, we decided it was time to move back west, and we ended up in Phoenix.
Wow. Fantastic. When did you end up in Phoenix?
Came here in 99. So I think I'm almost naturalized. If I think that would be the case. It's funny. I talk about, I never thought I'd live in a hotter place than Texas, but man.
Are you still a Dallas Cowboys fan?
I am. I grew
tough
up
season this year.
A tough 20 years.
Yes.
I mean, it's just been heartbreaking. My son, who's now in his late 20s, was a big Dallas Cowboys fan when he was in middle school. He's completely given up, but I still have a little bit of hope.
Yeah, Jerry, maybe he can do it next year. We'll see.
I'm not going to make any comments on that because I'm going to get in trouble on that one.
So, I introduced your title. You're a physician, practicing primary care physician. Yep. You're also a chief transformational officer. Yep. Not exactly a common pairing. So how do these two roles inform each other?
It's a good question. And so there's really, I think, three elements actually to my background, which we can talk more about, that sort of feed into this role. The first piece is, as a physician, and I still see patients. I was in clinic on Tuesday, saw about 20 folks before noon. It was a busy day. Lots of illness still out there right now. And from that perspective, I understand how health systems work, and I can speak to my nursing and advanced practice provider and physician colleagues. The second piece is I've spent a lot of my career focusing on technology and how technology works or doesn't work in healthcare, and we can talk a lot about that. And then the third arm is trying to bring the rigor of, say, an MBA or a senior executive to how we operate HonorHealth in a way that maximizes what we can do for the community. And so as the Chief Transformation Officer, I have three broad areas that we'll talk about. One is all the digital capabilities, artificial intelligence, technology, marketing. Second piece is around innovation and the work we're doing there. And then I actually now lead strategic partnerships and mergers and acquisitions. So three very different pieces.
They are very different.
Yeah.
And, it's interesting, primary care, and I love the fact that you're still staying involved. You're still, touching and involved in medicine. And this transformational stuff is exactly as it's described. It is transformational, what you guys are doing at HonorHealth, and then the MBA business. So when you are talking to somebody outside the healthcare realm, how do you describe what you do?
I basically try to explain that nobody is happy with the way the American health system works today. Patients find it incredibly complex to navigate through. Physicians are stretched and overwhelmed. Nurses are feeling in the same space. Employers are wondering why they're spending so much money. I mean, in every place you turn, everybody's got concern. And I'm worried about the American health system. And so the role of the Chief Transformation Officer is trying to figure out, how do we change who we are? Not change how we are. How do we change what we do to make it easier for patients to navigate, easier for physicians to treat folks, And ideally, can we do it at a lower cost? Can we actually lower the cost of care or at least slow down the increases? And that really is a transformation.
You left off one thing, the big bad wolf, the insurance companies. I know, and it's really hard to, I don't find too many people that really love health insurance companies. It's really quite a challenge.
Well, I try really hard to, number one, know that many of my colleagues who are in that space are trying to do their best and they're trying to shepherd those resources. But it's certainly true, and I'm worried about it, the level of sort of tension in that adversarial relationship between health systems and insurance companies is only getting worse. And I think it's a reflection of all these other sort of tensions in the system.
And, it's hard as a patient, it's hard as a provider. To really embrace our healthcare insurance companies just because they are counterproductive to what we want to get out of them, right?
It's hard. I mean, when you're sick, and I always try to teach this to the young physicians in training, I'm of a certain age where I've been sick now. And when even if you're a doctor, when you're sick, it's scary, it's frightening, you don't know what's going to happen. So patients are at their most vulnerable at these spots. And then to have to go through all of the other rigmarole of navigating the health system, it sort of adds this other layer of tension onto the whole piece.
Well, we're not going to solve it here today, but one of the things that I really want to bring to light is the fact that you are at the intersection of really, I call it strategic partnerships, innovation, digital strategy, and operations. That's a massive portfolio that is under your purview, if you would.
Well, I'm super fortunate. We were talking earlier about our CEO, Todd Laporte, and he had a vision a number of years ago that we could bring technology into sort of the fold, not just have it sort of sitting off to the side, but really bring it alongside these other major parts of the health system. And so that's been something that, he gave me as a charge, and I've really wanted to focus on it. And I think what it allows you to do is put together things that sometimes are at odds with each other in organizations and try to make them meld with each other.
I had the opportunity to go see the Transformational Center with CDW, partnership. And, you talk about innovation. Yeah. I mean, what you guys are doing there, and Todd Larson is leading your team, is nothing short of amazing. And not only just in an acute setting, but also in a post-acute setting and in a home care setting, which is really my vertical that I am in, is incredible to see.
What I love about that place is it makes innovation tangible. And it makes it tangible for people like yourself coming to visit. It makes it tangible for our own employees. So we talked earlier around doctors and nurses sometimes feeling burdened or stressed out. The chance to see innovation in a tangible way, it gives people hope. Like we're going to try to make things better. We're looking for better solutions. And as you mentioned, you probably saw there's that room in the back that's a home, the smart room of the future in the home. How can we keep people where they're most comfortable?
And I mean, let's face it. I mean, ambient monitoring. I mean, the fact that you can have things in the room or in the home where you're not hooked up to, a cuff, or you got, something that you're wearing. The setting in that environment is detecting respirations. It's detecting heart rate. It's detecting blood pressure. It's detecting all these things. For me to see this in my lifetime is nothing short of amazing.
It's super exciting. And we're all wearing some smart devices. And when you look at the accumulation of that information over time and you see the trends, it gives us a whole nother view of looking at our patients and being able to hopefully sort of intervene before they get into trouble. And at least that's what our real hope is.
So you're deeply involved in AI, informatics, analytics, and process improvement.
Yes.
Where is AI truly delivering value today?
So I would say, first of all, the fun thing about AI is you open up every newspaper, you open up every social media feed, and everybody's talking about it. I've never seen so much hype about a technology. And by the way, I'm a technology person. I've focused my whole career on it.
Sure.
And I really want technology to be the answer to a lot of the problems we talked about with healthcare. Some of the two areas that we've seen some real value from AI in healthcare, the first is our ability to predict what's going to happen to a patient even in the next couple of days. And I'll give you 2 examples where we've really seen some benefits. One of them is clinical. So we were talking about monitoring all of these different measures of a patient when they're in their home, but we do a similar thing in the hospital. And so we can collect information about people's vital signs, their labs, their medicines, whatnot. And we now have AI tools that are monitoring that. And if it sees that a patient in the next 6, 12, 18 hours is going to get sicker quickly, it alerts us that we need to go see them sooner than we normally would. And what that has allowed us to do is see that we have fewer unexpected moments in the hospital where somebody has to go to the intensive care unit, because we know if you do that unexpectedly, it's a very high risk event. And we've been able to show reductions in harm and even mortality. That's been an amazing piece. Another prediction that we make is when you come into the hospital, we make a prediction the day you come in as to the day you're going to leave and where you're going to go. And you might think, well, who cares about that? Well, it turns out if we wait, almost everybody wants to get out of the hospital as fast as possible.
100%.
And if we wait till the last day to sort of realize that you need some things at home, or maybe you need some special equipment, or we need a specialist to see you, if we wait till the end, then that can delay you getting out of the hospital. And so we've learned how to make the prediction of, hey, within 3 days, we think this person needs to go home. We start on day 1 planning for that discharge on that date to that location. Let's get ready for that. We've seen tremendous benefits from that. Those are 2 tangible predictions. The other tool that we're starting to use is an ambient tool that listens to a doctor and a patient when they're having their conversations, and it transcribes the note for them.
Oh, I love it.
It's so exciting as a doctor, because one of the things that's hard for us is oftentimes when I'm seeing patients, busy day, I wait till the end of the day, I go home, I say hello to my wife, we have some dinner, and then I sit down at the computer and I start going through all my notes. And we have physicians, including myself, who might be up till 10, 11 at night doing those things. Now it can listen to us. It can make 90% of the note. I read it. I want to make sure that it's correct. And that not only, it does a couple of things. It lets us have a conversation between the 2 of us, as opposed to the old days when I'd be staring at the computer instead of my patient. And it lets me focus my thinking on you, not, how I'm going to enter things in the computer. We haven't seen as much efficiency gain from that, but patients love it, doctors love it.
Well, I would think you see efficiency, especially in the personal life of physicians, because you probably aren't up to 10, 11 o'clock at night now. You've already reviewed everything,
Yep.
and now you can actually learn, or you can spend quality family time, or binge watch one of the Netflix episodes that is going right now.
Well, and it reminds me of things I need to catch up on. So a couple of things. At HonorHealth, we are still doing the data gathering for this phase. What's been interesting is nationally, there have been a couple of papers that have been published in this area, and some organizations have found actually the time savings. Some organizations haven't. And what we think it has to do is making sure that you're really engaging with the physicians and giving them enough training and support, and you try to get most of them using it, as opposed to, hey, here's a tool, use it, don't use it, and you just put it out there. There seems to be something to the implementation itself. It's not automatic. And so at HonorHealth, we're really focusing on doing that in a more rational way.
My small little home care company, we've been doing this for almost a couple of years now,
Yep.
And it is incredible. I mean, my care coordinators, my schedulers, my team members are able to be more relational with their encounters with the caregivers, the clients, their families, because they don't have to have their head down typing or writing things down, because they can be present. And isn't that a wonderful thing? I mean, making eye contact, learning, and not only just talking about the medical issues or health challenges, but learning a little bit more about the individual and their life and what they're doing.
It's so important because healthcare is all about the human connection. And there's so much, one of the things that's nice about being a physician who still sees patients is I can see there is the science, there's getting the right diagnosis, there's getting the right medication. But as you alluded to, making that human, that empathetic connection to patients, letting them know that it's okay to be scared, to talk about that so they feel comforted. Computers have really gotten in the way of that in a lot of places. And so to a certain extent, we're restoring that nobility, that connection in the care experience.
And, I think everyone experienced this during COVID. I mean, let's face it, it was somewhere in the 20% adoption for telehealth prior to COVID.
Yeah.
And now today it's still over 70, maybe even close to 80%. And as I understand it, having physicians in my studio with me on shows like this, physicians love it because they get a chance to see where the client, or should I say in your case, the patient, where they live.
Yeah.
And you get to see their home. And a lot of them are like, hey, Dr. Whitfill, check out my dog. Hey, I want to show you, my garden in the back. You get a chance to see how they live. And you don't get that when you're in an exam room.
It's really a great insight, and it's super true because the patient's home environment has such an impact on their health. And we've never, prior to this, we would ask the questions as physicians, but there's a total difference between somebody telling you what maybe living in a rough neighborhood is like, or maybe having to share a house with like 6 other folks, and when you can see it with your own eyes.
Makes a big difference. It really does. So, doing some research on you, I learned a little bit about this thing called H2Go.
Oh, yeah.
Yeah. So, and what is that, and how does that relate to what you're doing over at HonorHealth?
So one of the early challenges that we wanted to tackle as part of our transformation effort is trying to make accessing us at HonorHealth easier than going to organizations like the Department of Motor Vehicles, for example. And most people would say that contacting, health systems sometimes can be difficult. So we spent a lot of time putting together what we would call a digital front door, or a digital suite of tools, so that patients can access us in the way that they want to access us. If they want to call us, we have a centralized call center. We make sure that we're staffed well in there. We use technology to make sure that we have all of the information that the call center needs. But some patients want to text. Some patients want to use an app. Some patients want to go online. Some people want to chat. So we wanted to create a whole suite of tools that allow patients to access us in the way that they wanted to. And I knew, because we had our marketing team as a part of this, if we came up with some clunky technical name, nobody would really get too excited about it. So we actually had a contest at HonorHealth. What do we want to call this collection of suites? And actually, one of our nurses submitted the name H2Go. We loved it, and we've used it ever since.
So the HonorHealth Innovation Council is a very compelling model. How do you decide what to pursue and what not to pursue?
Innovation, there's so many places that one can innovate. And my colleagues who really focus on this, I'm going to play amateur here. You can innovate in process, like we do things a certain way. Let's just make it better. You could innovate in product, like I'm going to make a new widget or a tool or device. There's even financial innovations in the form of venture capital. So what we've done is we've taken a couple of approaches. The first thing is that we are focusing on innovation in 3 main ways. The first way is we have a small venture fund, which allows us to see what's going on at the very edge of new companies coming around. And our team reviews about 200 companies a year, and that lets us see where the industry is going. So that's stage 1. Stage 2 is we partner with companies, as you mentioned, who did like CDW, did the Innovation Center. And we look at early stage technology that is available, but maybe not being adopted. And we put it into a place where nurses and doctors can touch it, can see it, can look and figure out how it might work in their workflow. And then the third thing that we look at is we look at our own processes in the organization. And we talked about process improvement earlier. So we have ways that our own employees can say, I've got an idea. We should do this better by doing X, Y, Z. And we try to aggregate that information. The last thing that we do is when we think about innovation once a year, we bring the top folks in the organization together and we say, what is the biggest problem that we have that nobody is solving? And we name that. Oftentimes the last couple of years it's been around workforce. So we say, if we can find people that are solving whatever this top sort of innovation strategy, it lets us, whether we're trying to have a new process or a new investment, it lets us really say that's important to us.
No, I like that. I mean, look, the way innovation happens is to solve a big problem. And you got to identify that problem and figure out how to solve for that. I mean, for me in my home care space, there's no bigger problem than the numbers, the data.
Yeah.
You know, the fact that our 65-year-old population in the next two decades is going to double, and the 85-year-old population is going to nearly quadruple. So how do we care for all those people? That's a challenge. It really is a big challenge. That's one of those big hairy beasts out there that we got to figure out how to handle, both you and I.
Yeah.
You know, you mentioned workflow, and I mean, that's where we've been successful, and I'm sure you have as well, not just with the physicians in terms of the encounters with the patients themselves, but just processing workflow. I mean, we at our home care company have used technology and innovation to handle repetitive and redundant tasks that machines can do, so that we can be more relational in our encounters. I would imagine you're doing some of that over there at HonorHealth.
We are. We have an electronic healthcare record that we have two big software tools that drive a lot of our processes. We have something called an electronic medical record, or an EMR. We have something called an enterprise resource planning tool, ERP. Both are sort of wonky, but the two of them have so much capability to automate workflows in trying to take some of this complexity of the administrative side out. And what I am most excited about is what I've seen in the last 18 months is a tremendous acceleration in terms of capability in these tools. So the ability for, like, we're having to work harder just to keep up with the new capabilities that are coming online.
It is fascinating to me. I mean, we talk about artificial intelligence, and you're right. I think AI was the Time Person of the Year.
Yeah.
I mean, so it is it's on the tip of everybody's tongue. And, you know, one of the things that, you know, we do, and I know you do as well, is predictive analytics, right? So if you know the person, how old they are, you know, their comorbidities, their ethnicity, you can dump all that stuff into a funnel, and you can probably predict some outcomes before they even actually happen. I'm guessing that you're doing that right now.
We are. So we have a part of HonorHealth, something called Innovation Care Partners, is the portion of our organization that manages something called value-based care that I'm sure you're familiar with and your listeners.
Yep.
And so in that organization, we're much more attuned to preventative interventions. And in that environment, we're trying to figure out who's going to get sick in the next 3 to 6 months, who's going to end up in the ER next week or next month, and how do we find those folks? Because again, the workforce is small and we don't have as many people as we'd like to, and things are expensive. If we can figure out who to reach out to and do those interventions, it makes a big difference.
And that's the beautiful thing. I mean, you, in your background, you spend a lot of time over at ICP, Innovation Care Partners. And, you know, for our listeners, you know, I know they're an accountable care organization connected to HonorHealth, but can you explain to our listeners a little bit about who they are? And I know that they have team members that go out and visit the patients themselves, and they are that resource to be able to connect them to better health.
I think I'm excited to share about that. So a lot of the American healthcare system, including big portions of HonorHealth, are still paid by the government and payers, insurance companies, on something called fee-for-service. Fee-for-service is pretty straightforward. You do an event like an office visit or even a surgery like an orthopedic procedure, somebody pays for it. In that environment, the incentives, the financial incentives, are to do more things because you get paid for doing things. What we're trying to do as a country is also add something we call fee-for-value, or value-based care. And the idea there is, instead of paying for events, you're actually paying for outcomes, like, for example, increased quality, or maybe even decreasing cost. And so it creates different financial incentives to help motivate folks to be able to do things that maybe don't make sense financially in a fee-for-service environment. And so if you're responsible for a whole population of folks and you say, hey, if I can increase their diabetes care today so that they don't get sick tomorrow, and now there's an actual reward for that. By the way, in addition to the altruistic thing that we all want, like as clinicians, we always want that. But sometimes when you're trying to keep the lights on and your margins are getting compressed, you do what you have to do to keep the doors open. This allows us to start focusing on quality, cost, and outcomes in a different way.
I love it. And I love what HonorHealth is doing. I loved having Todd Laporte here talking about the longevity stuff that they're doing, the center that's going to be opened. It's breathtaking. I mean, it really is. It's exciting, and I can't wait for it all to happen. And it is happening right now as we speak, which is really exciting. So one of the things that's happening as we speak right now, and it's a bridge today and tomorrow, is the partnership with ASU.
Ah, yes.
Yeah, and I've met John Schufelt.
Yep.
I don't know him well, but I've met him a couple times. His philanthropy is amazing, what he's done to ASU Medical School, but the partnership and the fact that the transformational piece that you do and primary care and having ASU Medical School working hand in glove with HonorHealth has got to be really exciting for you. And I think that there's a huge alignment with what Dr. Schufelt is doing and what you're doing as well.
In fact, I spend Thursdays at ASU, so I got to spend all day there. It's fun to go down, be with a bunch of students who are way younger than I am and remind me of those days from long ago. We talked at the beginning on how one of my major portfolios is around strategic partnerships. And so my job is to connect to ASU for all of the non-educational faculty things. We have folks that are doing that work in terms of getting the school up and running, but for all of the other collaborations around innovation, around workforce development. We've brought our 2 nursing units together, the Edson School of Nursing and our nursing leaders, to be able to look at that. We're looking at technology, research, artificial intelligence, all these pieces. I'm super excited about it. To go to the last piece, I mean, we've just begun to scratch the surface because we want to make sure we get that medical school opened up, which we are interviewing now, and we'll be bringing in our first class this coming summer of about 35 incoming students. Super exciting.
I mean, we're going to get homegrown doctors right here in our backyard for our communities, which is amazing.
Well, when we poll the community, what people want is they want physicians from Arizona to stay in Arizona.
And the fact is in Scottsdale, and I know HonorHealth is much bigger than Scottsdale, Maricopa County, but Scottsdale, where we're at right now, they're expecting our population between now and 2030 to increase by 100,000 people. So, everyone that's going to need healthcare needs, and especially as I shared with you the data, the fact that our 65-year-old population is going to double in a couple dozen years, and 85-year-olds are going to be nearly quadrupling in a couple dozen years. We're going to need physicians to be able to help them through that journey of life.
Absolutely. In fact, when you look at the data, what we need in Scottsdale are more nurses and physicians. We have enough of the inpatient side. It's the outpatient side that we need to invest in. And nurses and doctors are sort of a shining example of what we need to focus on.
So I know you're a visionary. And certainly, what do you see that we need in terms of future healthcare leaders for today and 20 years to come? Because what we have now is going to be very different from what we need in 20 years.
So things are changing so quickly. For example, in the medical school, we're granting not only a 4-year degree as a doctor of medicine, but also a master's in medical engineering. That's one of the unique aspects to this.
I love that.
We're hoping that these upcoming doctors will know how to design the tools that we need for the future. And we think that the biggest skill is that skill to adapt, to evolve, to be able to understand how technology and healthcare work together. So the way I think about it is that being a great physician is a mix of science and art. And we talked at the beginning around how looking somebody in the eye, being with them, comforting them when they're in a place of difficulty is still super important as physicians. So we want our young doctors to be able to do that. We have more and more technology that comes into play. And so they need to be able to be conversant, facile with the technology, evolve with it. We don't even understand what technologies are going to be done when they graduate.
Right.
So we have to train them for that. And then the third thing is there's a lot of medical science in terms of what medications work, what surgeries work, what doesn't work. So we're trying to look for that sort of magic connection of all three: great clinicians who are great human beings, who are engineers, who can design the future.
And you hit design. I mean, I would think some great innovations are going to be born right here, because they already are beginning. But I mean, knowing that you're going to have, hundreds of doctors that are going to be going to school. I mean, these young people, engineering, medicine, that is like the perfect combination to really innovate. And collaborating with ASU and HonorHealth, it sounds like it's a marriage made in heaven.
We're super excited about it. Every time we work together, we only feel more validated that it's the right partnership. Certainly, if you go around town, you see ASU number one in innovation. And if you think of how ASU has transformed over the last 20 years, it's really become a very different American university system. And
Dr. Crow.
He's pretty incredible.
Dr. Crow.
He has that vision and he just drives towards it. So we can imagine that designing the next version of the American health system very realistically could come out of Arizona. And that is something that we're really focused on.
Great segue for my next question. So if you were going to redesign healthcare from scratch, what would you get rid of and what would you keep?
I would change we talked a little bit earlier about the tension between physicians and insurance companies or health providers and insurance companies. The financial models really are just super complex. We estimate that there may be 20 to 30% of waste, both from administrative functions, but also we don't do the right things. It's sometimes because we don't know what the right things to do. Sometimes it's because the incentives are lined up. So I would change the whole financial structure. I would also make us more comfortable with team-based care, because the reality is you and I were talking about so many people, 65, 85 coming. We have more demand coming than we have supply. And I love being a physician. I love my physician colleagues. Physicians are phenomenal. I like seeing a physician when I'm sick, but the reality is we're going to have models where we have technology, we have people of different backgrounds and licenses and capabilities, and physicians all working together to be able to meet this growing demand.
And it is a growing demand. And it doesn't just mean physicians. I mean, it's other people, like you said, team members.
Yeah.
We as human beings need to be held accountable. And as primary care physicians, you only get to see your patient, 10 minutes, 20 minutes, whatever that encounter is, but then they go home.
Yep.
And it's how do we make them accountable with the recommendations, the discharge orders, or whatever those follow-ups are supposed to be done. And I think it's really important to still have that connection. And I really believe that is part of the future, probably definitely part of the future plan for HonorHealth.
I think about the following maybe silly example. Hopefully I won't embarrass myself, but there are well-known online shopping experiences that seem to know exactly how to get me to buy things that I never realized I wanted to buy. Imagine if we could bring that same knowledge and insight to a patient to help them understand to make good, healthy choices. And it's not just me handing a book to somebody and saying, okay, you should do X, Y, Z or a set of instructions, but maybe we figure out a way in a way that respects autonomy, but we use that creative marketing capability to meet people where they're at, but help them make the best choices for themselves.
We talked about the Longevity Center and we talked about, Better Health and obviously you probably know Peter Attia and his book Outlive and the concept of medicine 1.0 to medicine 3.0. Would love to hear your thoughts and your feelings about that transformation that we as a community need to really do. Todd was here on our show over a month ago, and he talked about the Blue Zone, and he really brought the Blue Zone here to Scottsdale, and I give him such credit for doing that. He was the first one in, and then others followed. But how important it is for us to really change our lifestyle and be really more proactive, preventative, and being able to live the best lives we can.
Well, when I think about a lot of times people will come to me as a physician who's had a lot of fancy degrees and whatnot, and I look at the following issues. Number one, we talked about the American health system being at a time of almost crisis. If you think about our life expectancy, if you think about our general measures of health, obesity, our numbers are all going in the wrong direction, not the right direction. So just collectively, if you put everything together that we're doing, it's not working, right? So we need something different.
We do.
And I think it was Einstein who said, if you just keep doing the same thing over and over again and you expect a different result, that's the definition of insanity. I think what you're seeing with our integrative wellness center, when you see this focus on the blue zones, it's an acknowledgement that we have to be looking at something different. We're going to continue to be there for the community when they're sick, and we're going to deliver the types of care that we know works. But if we can figure out how to get more upstream, if we can figure out ways to keep people healthy before they get sick, we are in the one industry I know of, we don't want people to come to us.
Right.
We really would rather you stay at home and be healthy. We actually don't want you if you're going to have to go to a hospital, we want you to come to our hospital because we think that, we're founded in Scottsdale, we're anchored in Scottsdale. But what we'd rather do is keep everybody well and at home.
100%. It's really interesting where we're at, especially as a society. And I certainly want to get your take on this is GLP-1s. They're like the magic drug that people are gravitating to. It has great benefits. It's been around for almost 20 years for diabetics.
Mm-hmm.
Would love to hear what your take is on it, because we know that Hollywood and even people here in our community, a lot of them are using it and maybe don't really need to use it. A lot of them are going on and off of it. Would love to get your take on that, Jim.
So I think we're still in the early, if we use a baseball analogy, we're in the early innings of the story on GLP-1s. A couple of thoughts, and then I'll wrap them together. The first is, as a physician, and I've been in practice for nearly 30 years, we've been struggling from a science perspective to find something that achieves weight loss. And this is the first time I've seen something that actually works. Now, I'm not saying that it doesn't come without some important side effects that we'll talk about, but the fact that we found something that works is that in itself is amazing. The second thing that's really interesting is that we're seeing that oftentimes when we find new medications, they come with, it helps with A, but it causes a lot of problems with B, C, and D. And B, C, and D are really major things. This is one of the few times where I've seen for people that are truly obese, and if they can lose the weight, heart disease, kidney disease, even maybe brain function get better. So those things I find to be almost kind of awe-inspiring that we're seeing them. However, there's this other part. Number one, there's a cost. The cost to our country, the cost to insurance companies, the cost to the government, the cost to individuals. We don't have the money to pay for the amount of need for these. So there's a financial component. The second piece is there's some concerning things around, number one, people lose muscle mass when they're on these things.
100%.
And so it is not a, free lunch, so to speak, or a magic bullet. It's a powerful tool. But I continue to think that we need to learn, how do we help people use this period of time on a GLP-1 to learn to change their diet, to change their exercise in a way that sort of gives them an advantage, where their willpower, they're not overwhelmed by hunger and some of these other pieces. I think the jury's still out. We still haven't figured that out. That's one of the things that we really want to do with the HonorHealth Integrative Wellness Center, is to help people say GLP-1s can be helpful, but let's try to figure out how we change diet, exercise, lifestyle, and have those be the long-term tools.
And I've heard physicians talk about promoting GLP-1s, but promoting it in concert with a nutritionist and exercise, because your point is absolutely right. You lose muscle mass. And I saw that with a friend of mine that went on it, and he lost over 60 pounds, but next thing you know, he was hunched over and he looked gone.
Yeah.
And then I saw him about 6 months later, and he was spending a lot of time in the gym, and he did a little bit of testosterone to really help him out, and he looked great and lost the weight. So I think it's that balance, and certainly it's for those people that are extremely heavy. I mean, if you look at pictures, Jim, if you look at pictures from the 1960s of people on the beach, very seldomly will you find obese people. I think the population in the United States was about 4% obesity. And today it's like over 40, it's like 44%.
It's so funny you say that, Bob, because last night I was on some social media channel and I saw a video of the Talking Heads from like 1976. And everybody was so thin. And you see this with every piece of media.
Right.
And our whole country, the whole world is changing. And it has changed. And we really need to find an answer to that.
We do. Well, it's a start for sure. So I want to move our conversation to do some rapid fire.
Okay.
Are you ready for some rapid fire?
Bring it on.
All right. So one healthcare trend that you're bullish on.
I think that we are getting a handle on healthy living in a way that we haven't in the last time.
I agree 100%. What are you skeptical of?
To be honest, I'm really skeptical about AI. I think there's a lot of capability there, and we are expecting it to fix everything in healthcare. I think it's going to be a powerful tool. I think it's going to help us. I think, unfortunately, we're going to, like the GLP-1s, we're going to have to do a lot of other work in order to fix this health system.
Great. Best leadership lesson medicine taught you?
The best leadership lesson is that you can know lots of science, you can know lots of facts, but the most important thing about being a leader is being able to connect with folks wherever they are in an authentic way. And if you do that, you can achieve great things.
Oh, I love that. So true. What frustrates you most about healthcare today?
How hard it is to get care when you need it. I have my own patients. I have people who call me. I know that there is so much more demand that and we at HonorHealth, I think, are pretty lucky in terms of what we can do, but I know that there's so much more demand out there than there is supply.
Getting in to see a specialist is not easy.
It's hard.
It really is hard. What gives you hope?
I get my hope from America. I mean, this is going to sound a little bit corny, but you think about, we're coming up on, I think, on our 250th
Isn't that crazy?
anniversary as a country. And Michael Crow said something earlier this week. We're just at the beginning. We're just at the beginning of what the American democratic experiment is. And I have we're at a tough time in our country. There's a lot of division, but I've seen the American spirit come out over and over and over again. I have a lot of hope for us as a country to be able to tackle some of the really big challenges in front of us.
What is the one piece of advice that you would give to young physicians interested in innovation today?
The first thing that and I'm going to take your question and I'm going to spin it a little bit.
Okay.
A lot of people ask me, Jim, would you dissuade your children or others from going into medicine? And the first thing I tell them is no. I think medicine is a phenomenal career. It is very challenging. For people that choose medicine because they think it'll be prestigious or they're going to make a lot of money, I tell them that's probably not a good choice because it's so hard. It is so taxing emotionally, physically, intellectually. Don't choose it for those reasons. So that's the first piece of advice. For people that are thinking about innovation, the thing about physicians is there's so much opportunity to innovate on all the problems that you see. And so physicians historically haven't been business people. They haven't been innovators. They haven't been entrepreneurs. There are some, but there's so much improvement that we need. Follow what you see is broken. Look at what's in front of you. Use your knowledge of the workflow to come up with better solutions.
I love it. I'm going to ask you a couple rapid fires that include HonorHealth. Okay. So one Arizona-based partnership or innovation you're most proud of?
You know, it's interesting. We just opened another intuitive health complete care in the last 2 weeks, and I'll talk about what these are. We have one over at
Tatum. Yeah.
Shea.
I've been there.
I have too.
It's impressive.
It is incredible. I will tell you a story. Hopefully this is not too embarrassing. My wife was out of town. Our kids are we're empty nesters. I was biking down along Tempe Town Lake. I had to go to Boston the next morning to be on a panel, and my tire lost traction and I fell and I hurt my shoulder. I knew that I couldn't even move my arm. I knew that there was something really wrong. And I was like, I'm going to have to go to the emergency room. I biked home and went to that center on Shea
between Tatum
and 56.
56th Street, right?
It was an incredible experience. You know, I was in and out in a short period of time. People were super friendly. By the way, for your listeners, it has an urgent care piece and an emergency room piece. So if I hadn't broken my collarbone, which is what I had, and it was just bruised, they would have sent me to urgent care. So they're able to do both of those things. It's a completely different experience. And I think that is just incredible.
Well, I'm going to tell you, I went there several years ago, just after it opened, and waited like no time at all. And I felt like it was concierge. Mm-hmm. I mean, the doctor came in and You can run most of the tests that you would run in an acute hospital in this complete care center. It was fascinating for me. And the first time I was there, they were able to remedy my situation. The second time I was there, I needed to go over to the hospital. But the coolest thing about it, Jim, was that I got to get a pass going through triage.
Yeah.
Because they had already had all my records. They were waiting for me, and then they took me right back, which was really, really fascinating to me. I think that's a great concept. So is HonorHealth going to do more complete cares?
We will be.
There are no beds there, but there's everything else.
And they're all connected. Each one is connected to one of our main campuses in case you really do need a higher level of care.
Right.
But on the other side, almost 60% of the patients who come in, we send to urgent care. Lower copays, less expensive. It's the right care at the right place.
Oh, I love it. So if HonorHealth could be known for one thing nationally in 5 years, what would you want it to be?
When we ask people who come to HonorHealth, what's unique about us? What they tell us is it's our approachable experts. We think that that's special because there are lots of places that have ivory towers that have brilliant folks, but you can never see them. They don't take a lot of insurance. They're hard to access. We have some incredible clinical talent, but they're approachable. We live in this community. We're a part of this community. We think that that's our differentiator. We think that that's our special sauce. And so we want to really continue to lean in on that.
And I want to just piggyback on that. I've been coming here over 40 years. And back in the day, it was Scottsdale Memorial, and it became Scottsdale Healthcare and HonorHealth. And you would think as a hospital system that you grow like that, you become less community focused, and you guys have been able to keep that community feel and that allure even as large as you've gotten, and that's impressive for me as a member of the community.
Well, thank you. We put a ton of focus in that, and to be honest, it motivates people like me and our leaders. We could be at other firms that are more transactional focused, but the fact that we're really grounded in trying to serve the community and we believe it, it motivates us every day to be better.
I love it. So a couple of fast ones.
Okay.
Beach or mountains?
Mountains.
Scottsdale or Phoenix?
Ooh, I live in Phoenix. I work in Scottsdale.
Ooh, there you go. You got both.
The cheating.
Let's see. Long-term vision or rapid iteration?
Ooh. Long-term vision just long-term vision.
So I really want to wrap things up. I can't thank you enough for the time here today. And I know that there might be questions I haven't asked or some lasting thoughts that you might want to leave. We're at the intersection of medicine, technology, and humanity, and it's a rare place. But Jim, I really appreciate you being here. I've heard so much about you. I heard about you years ago from Todd Laporte, and he said you need to meet Jim Whitfill. And you know what? Bill Bear made it happen, and I'm really appreciative of him doing that. But is there a lasting thought or message you would like to leave our listeners and viewers here today?
I would first of all, I'd like to thank you for letting me come on here and talk about more about HonorHealth. We are really, as we talked about earlier, we're just super committed to this community. We have a vision for transforming care in this community that we serve. And so giving us a chance to talk about that is just amazing.
Well, I love what you guys are doing. My family has been benefactors to the foundation for over 40 years. We haven't really talked about the foundation. If you would like to, maybe leave a lasting message about the foundation, because the foundation is really part of and parcel to make a lot of the innovation happen. And I think of like the Bob Bouvet Neurology Center. So those types of things, if you wouldn't mind, share some of that.
Absolutely. And Charlene, my wife, and I are benefactors. We donate heavily to the foundation. We think it's important because it's a way to cover the gaps and the things that the community needs that may not be paid by the way that our health system decides to finance things today, the insurance companies and whatnot. And so whether it's the greatest needs for employees, we have an innovation fund. So we're trying to look at how do we build a better health system for tomorrow and everything in between. So the foundation really is set at how do we continue to create that alternate funding source to be able to do the things that our patients absolutely need, they totally deserve, but the world doesn't seem to provide for it today.
And the beautiful part of it is, as I shared before, you're still viewed as a community hospital, and the community is stepping up. And it's these members of the community that are so philanthropic to be able to help HonorHealth innovate and be able to keep up with the times.
I look at our foundation board. I look at the HonorHealth board. It is made up of people from the community. That helps us stay 100% anchored on this community.
Well, Jim Whitfill, Dr. Whitfill, thank you so much for joining me here today. Thank you, our audience and our listeners and our viewers, for joining us here today. Make it a great day. Have a great week, and we'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com.